Introduction to Human Resource Management current issue concerning the impact of COVID-19 pandemic towards HR planning. So, introduction in human China's brand new coronavirus, continuously known as coronavirus, has been described since December 2019. Since then, COVID-19 has widespread across China and the rest of the world. It might result in symptoms include fever, brain problem, colic, and even lesions in both lungs of the patient. Viral pneumonia can result from the virus sensitive to the lower respiratory system. Patients who have severe illness also have this spike and respiratory distress syndrome. Despite having a lower death rate, the pandemic has a much bigger number of sick people than the middle respiratory syndrome and severe acute respiratory distress. Additionally, countless cases of illness and 3 fatalities. City of Human Health, the focus of intensive action. Of the view, both China and the rest of the world more experience a faster spread. The transportation center of China, Wuhan, is a tremendous transit necropolis with a population of over 19 million as of 17 nights. In January 2009, a pandemic in China's public health emergency of global signature. In addition, there is a lot of ways and discussion about outbreak in other parts handling it. However, the goal is this: easy to is private brain over of the current state, distribution, and potential future cause of the coronavirus outbreak in human based on the our first impressions working in with a few of COVID-19 cases. Besides the mention and going break of the virus as begun and serious threat with profound conscience of the company and furniture market as our world. Furniture market validate the culprits with the chance of view new global region. In addition, the foreign small business, especially small and medium experience and service, can lead to permanent costs and let loss this job as well as bankrupt individuals. Malaysia has even stepped preferred to stay at home for future forgetting from game and virus. Due for the anxiety when going to the supermarket, on public transport or traveling. There have also begun added the often ration the hand over the leg, corners, and dominant productivity mass, and will the created contact with committed object and service direct contact with smitten individual, direct contact with effect individual or distract to.
The HRP process main objective is to have the organization's management in supplying the right people in the right numbers at the right time and place to fulfill the organization's future need for human resources. The management will then handle the hiring process and staff selection to assist the organization in achieving its goals as outlined in its strategy and objective. One of the emerging consequences of the new norms is a reduction in hiring. Due to the high cost of paying new employees' wages during the MCO season, businesses are unable to hire new employees. This occurs because the company is unable to operate and generate a significant returns due to a lack of demand for its product. This is also related to our country's economic inflation, which has been decreasing year after year since the start of COVID-19. As a result, it has a significant impact on graduates who have recently completed their studies and wish to enter the workforce. COVID-19's impact on the Malaysian economy can be seen in the high unemployment rate and the decline in the value of the Malaysian ringgit. As a result, many sectors of the economy are affected, including the labour market. So, if there have a business that want to avoid losses while remain to stay operating, must follow the new and strict general standard operating procedure. Moreover, the company also encountered issue with employee performance. Most new employees who have recently entered the workforce face difficulties in learning and experiencing work, as well as developing the knowledge they gain while performing their duties in the office. Because of the COVID-19 outbreak, all employees have been instructed to work from home. On the other hand, COVID-19 has affected both new and existing employees. Employees, both new and old, will have to adapt to new norms such as working from home or implementing new workplace policies and procedures to limit human contact. These drastic changes have had a huge impact on employee performance and increased pressure on employees. This can also be linked to poor employee well-being such as absenteeism, lack of focus when working, decreased performance, and extended sick leave.
Last but not least, the process of human resource planning is crucial in determining an organization's existing and future personnel needs in terms of both quantity and quality. It is an essential process that directly links company plans, objectives, and human resource activities. This approach also protects organizations from a range of problems by preparing them for numerous internal and external factors that could have an impact on their operations. It needs to be taken seriously because it affects how well an organization's aim and goals are implemented and achieved. For any organization, human resource planning is important. Companies gain from resolving employee shortage or obstacles before they become problems. Business may implement the appropriate strategy to hire the best employees if they have a deep understanding of the hiring process. Employees are totally responsible for protecting their employees and ensuring that there are no workplace hazards that could endanger or even kill them. The current COVID-19 issue is causing difficulty for organizations all across the world to develop a safety and health strategy that will lower the risk of infection and coronavirus transmission on within the firm. Managers in this situation should work closely with specialists in human resource and healthcare organizations. In this case, the organization policies are essential for controlling the spread of the infection. To achieve this, they must abide by the guidelines provided by medical professionals, their government, and the World Health Organization. They need to provide the required protective gear such as masks, sanitizer, and social distancing for those who must be present in the workplace, and educate and teach their personnel on prevent behaviors. Additionally, they must include warnings about avoidance such as cleaning your hands and refraining from touching your eyes, nose, and mouth. Building trust and lowering employee stress at work will be aided by having clear preventive measures in place. They will feel comfortable and secure because of their employees. Moreover, training is essential for both during and after the pandemic. It is considered to be a protective mechanism against mental health issues. A good way to stop the spread of inspection is to educate employees about critical behavior. Lowering stigma in the workplace can be accomplished by raising public understanding about COVID-19 and the reasons for quarantine. Training must include managers as well. Due to the fact that COVID-19 is an unexpected crisis, managers should be educated and trained on how to handle it, which could reduce their stress. They must be trained in managing virtual teams while taking the teleworking environment into account in order to be of assistance to the team members. Development programs should be implemented in this scenario to assist managers